that the meeting is recording. Hello, good afternoon, everyone. This is Dominic Zerlo from the New Mexico Department of Health, and we do have a few Department of Health staff members who are here to assist. But this is the meeting for the End of Life Care Committee with the chair, Larry Leeman. And so we'll be turning it on over to Larry here in just a moment. But I just want to remind everyone that this meeting is being recorded. We will post recordings of all of our meetings. However, please remember it does take a few days for those to become live on our website. So please allow for about 5 to 10 business days. It's usually much less, but please allow for a few business days for that to happen. But we will have them available as soon as possible. Several of the other committee meetings and other meetings are being posted here in the next day or so. So if you missed them and are interested, you will be able to go back and review them. And with that, I will turn things on over to you, Dr. Leeman. It is your meeting, sir.
Great, thank you, Dominic. Thanks, everybody. Good to see so many people here. We have 32 people here. That's a impressive showing for our first meeting, which is awesome. My goal of the first meeting is twofold. One is just to get to know each other, just to do some introductions. The other is I was to start to see if we can get a little bit of a shared vision on what the committee is doing. So, the way I've structured it so far is to have us actually do, given the number of people we have, I'd probably say like 1 to 2 minute introductions of yourself, what your interest is, what's important to you, and then I'm going to drop us into looking at some bylaws and just looking at some things that I think could be touchstones for our goals as a committee. So I'll share that after we've each gotten to introduce themselves. To introduce myself, I'm Larry Leeman. I'm at the University of New Mexico. I'm a professor of family obstetrics, addiction medicine, and do research with psychedelic assisted therapies and therapy. And I'm delighted to be on this committee. How should we do it as far as like a circle? Have you done in other meetings as far as people introducing themselves in some type of an order? Any?
Yeah, if you would like, Larry, what we can do is we can go down the list of attendees and simply unmute them in order, and they can go ahead and introduce themselves if that's how you would like.
That sounds perfect.
Okay. So Adrian, I believe that you were doing that, as if you will unmute individuals and call on them going down the list.
Absolutely, Dominic, thank you. So first off, we have Herc Rodriguez, who has his hand up. Herc, your mic has been allowed. You will have to unmute it on your end.
My name is Herc Rodriguez. I'm a small business entrepreneur. I'm interested in the end-of-life care based on a business perspective. I've got a couple of different businesses now, and we just opened up a mushroom grow in downtown Albuquerque in an old 100-year-old adobe. So I'm open to any opportunity that is available.
Fantastic, thank you for that. We have another question in the chat right now with Lorraine, who's asking, is there a reason why we can't see one another? It is hard to know one another without a visual. Dominic, do you?
Yeah, I actually was typing one in, but I can speak it instead. Is part of the reason is what we have discovered in other large meetings, especially when there's this many people, is that individuals who are in rural or frontier areas where there is not very good internet, even if they stay off camera, but other people are, they lose connection regularly. We experience that with some other meetings. And so we want to make sure that people can at least participate We do understand as far as the visual that sometimes can be difficult, but we would rather have people participate rather than get bumped off just simply due to internet connection. So that is the reason for it.
And just to make it a little more simple for all the members of the who are attending today, if you wish to introduce yourself, please pop your hand up, and when you do, our wonderful health educator there, Adrian, will be able to systematically unmute you and be able, and if again, it won't be a case of you being called out, it's only if you feel comfortable, please pop your hand up and we can work from it that way. Thank you.
Thank you, Ishmael. Next, we have Kate Hawk. Kate, your microphone has been allowed. You will have to unmute yourself. Kate Hawk, your credentials, your microphone has been enabled. Go ahead and speak.
Okay, sorry, I thought it was unmuted. Now it is. Yeah, I'm Kate Hawk. I'm in Santa Fe, and I'm really happy to be part of this. Love the process. It's been so knowledgeable and respectful. So I've been a trauma therapist for over 40 years. Even before that, I've been working with psychedelics, member of the MAPS, the Multidisciplinary Association for Psychedelic Studies, since the 1980s. And I'm also working with specifically death and expanded states of consciousness, including psychedelics. I guess that's about all I will say about myself right now, except I'm happy to be here and I plan to participate fully in this committee.
Thank you so much, Kate. Next, we have up to speak is Danielle. Danielle, your microphone has been enabled. Please unmute yourself. Again, Danielle, your microphone has been enabled. If you are on mute, please unmute. Okay, and Danielle stated in the, I'm sorry, Dominic, that she doesn't have control of her mic or camera. So Danielle, what we'll do is we'll go ahead and you can put that in the chat if you like, at least to still engage. Also, we have the email posted if you're not comfortable posting that in the chat as well. So that way we may properly respond. So what I'm going to do, Danielle, is go ahead and lower your hand. And the next one in line to speak is Asher. Asher, your microphone has been enabled. Please unmute yourself.
Hello, my name's Asher. Thank you to this committee, everyone on the board, and all the facilitators for this group. Thank you. Yeah, I'm just beginning my career as a hospice chaplain, and I'm really interested in learning about how this is going to get phased into hospice, and yeah, just wanting to be a part of the process. I'm really excited about the potential for this to support people at the end of life, and to specifically to offer that care myself or create other pathways to make that happen. Thank you.
Thank you very much for that. Danielle in the chat has put that she is an end-of-life guide and death doula with a private practice, Conscious Crossroads End-of-Life Services. She also recently founded the New Mexico Death Care Network, a 501(c)(3) that helps provide end-of-life care such as death doulas to those who cannot afford it. Thank you for that, Danielle. If you'd like, Danielle, you can raise your hand again and we will enable your mic and we could try it again if you have anything further to add. Next in line to speak, I have Jen Katma. Jen, your microphone has been enabled. Please unmute yourself.
Hi, my name is Jen Katma. I have a home in Truth or Consequences, New Mexico. And I'm kind of, I'm at the crossroads of a few different paths into this space. One is corporate and public policy communications, and also chaplaincy and also psychedelics. So this is a really interesting place for me to spend some time and learn and contribute as much as I can. And I'm really interested in how we educate chaplains to be also providing kind of spiritual counsel in a psychedelic space. So that's a really keen interest of mine, as well as educating hospices and the roles they can play, and identifying those hospices that are sort of raising their hand. So nurturing them along the path to become providers. Thank you.
Thank you very much for that, Jen. And as Dominic pointed out in the chat, Dr. Rosin, just please verify that you might have accidentally clicked in multiple times. I know I just did that. But if you're able to, please raise your hand again, so that way we'll definitely call on you. Next in line is Catherine Warnock. Catherine, your microphone has been enabled. Please unmute yourself.
Hello, my name is Catherine Warnock. I am a licensed professional counselor in Las Cruces, New Mexico. I have been working with psychedelics for about 3 years now. I'm very, very excited, especially about this subcommittee, because it's pushing the envelope. The other states don't have this, the end of life, and I think that this is going to be a very exciting and interesting area. I'm here mostly to provide any, I guess, hands-on expertise. I've been working with clients in this using psilocybin for over 3 years. I went to TheraPsil in Canada to get trained, and I also offer training to practitioners doing this work, mostly because the current offerings of training are usually about $10,000 and a year long. And I wanted to be able to offer something for people that mostly that are already doing this work to offer harm reduction. I'm just here to serve in any way possible, and I'm very grateful for everybody that's putting their time and effort in this today. Thank you.
Thank you for that, Catherine. Next in line to speak is James Brown. James, I've enabled your microphone. Will you please unmute yourself?
Thank you, and good to see you, Dominic and Dr. My name is James Brown, and I'm a doctor of pharmacy here in New Mexico. I have been trained in Oregon with the use of psilocybin and psilocin. And my background basically in end of life is more palliative style. I have over 13 years in the space of the current Western medicine. I help current hospices with their therapy modalities, as well as treatments. And I'm very excited to be seeing New Mexico have access to this as one of those treatment modalities, bring it in as a medicine. I think this is very important that we look at this and have access to this for our patients. And I'm very excited to have this opportunity to be part of this wonderful group. And there's some amazing people here. And especially the chair, Dr. Leeman, I really appreciate you chairing this and everything that you've done. And so thank you, sir. And I'll keep it simple. And I look forward to everybody else talking to you in the future. Thank you so much.
Thank you, James. Next in line to speak is Meredith McBranch. Meredith, your microphone has been enabled. Will you please unmute yourself?
Hi, my name is Meredith McBranch. I'm planning on going back to school in clinical psychology, and I'm really interested in psychedelic assisted therapies. And I've watched several family members move through the hospice process. And so I think that, death and dying is a really important part of life, and ensuring equitable access to psychedelic medicine, no matter where you are in the life process, is really important. So I wanted to be in tune with what's happening in the state as a future practitioner and just person who lives here. So thanks for creating the space.
Thank you, Meredith. Next in line to speak is Brenda Burgard. Brenda, your microphone has been enabled. Will you please unmute yourself?
Thank you. My name is Brenda Burgard. I am a licensed practitioner here in the state of New Mexico. I am also on the advisory board for training and education and for psychedelics here. And I'm also the president of Decriminalization of Psychedelics of New Mexico. And I'm just here to hear, maybe offer some comments and to learn more about what we're doing in this committee here. So I can add this to the training that we need so desperately here in New Mexico. Thank you very much.
Thank you, Brenda. Next in line to speak is Lisa Ginsberg. Lisa, your microphone has been enabled. Will you please unmute yourself?
Hi, everyone. Thank you for your time and being here. My name is Lisa. I am director of Changa Institute. We provide professional certification and psilocybin facilitation in Oregon and Colorado, and have an experience in Colorado, specifically as a state that allows in-home treatments. I would encourage to consider creating additional training component and requirement for end-of-life patients, for practitioners who want to work in end-of-life care. In addition to the standard training for psilocybin facilitation, because these clients require additional support and care. Thank you.
Thank you, Lisa. Next up we have in line to speak is Dr. Rosin. Dr. Rosin, your microphone has been enabled. Will you please unmute yourself? Dr. Rosin, if you're speaking, we cannot hear you. Your microphone is enabled. Will you please unmute yourself? All right, I'm sorry, Dr. Rosin. For whatever reason, we still cannot hear you. At this point, I'm going to allow the next person to go in line and see if we can figure out what's going on. So next we have up in line is Aaron Ash. Aaron, your microphone has been enabled. Will you please unmute yourself?
Hi, everyone. My name is Aaron Ash. I'm an Albuquerque local. I consider myself a little more part of the underground psychedelic network for people who have tried the Western medicine route and their experience kind of left them either traumatized or institutionalized and just did not have the experience that they wanted. And so they've sought different communities in order to overcome mostly a lot of addiction work. And from my time working in addiction spaces, I've noticed that there's a theme of people who can't grieve. And so I've done some variety of different grief work and men's retreats. And the key theme for me is death and rebirth, both at the individual and collective level. So moving from old self and old patterns into a new self and new patterns. I really like the Tibetan Book of the Dead quote, to die before you die. And so I think it's really important. Just breathing through the fear of death in general seems to be a major theme. Thank you.
Thank you, Aaron. Next in line to speak, I apologize in advance if I don't pronounce it right. Next is Jason Jantunen. Jason, your microphone has been enabled. Will you please unmute yourself?
Hi, everyone. My name is Jason Juntanen. I'm a PMH NP student at the University of New Mexico, and I'm just very grateful to be able to be part of this forum. I have a very strong interest in medical psilocybin therapy, and I'm just excited to learn more about it, its clinical applications, and any education or training opportunities available to clinicians or future clinicians in that space. So thank you.
Thank you, Jason. Next in line to speak is Dr. Lida Fatimi. I'm sorry if I mispronounced that. Your microphone has been enabled. Will you please unmute yourself?
Yes, thank you so much for having me and having this beautiful group of humans doing great work. I'm Dr. Lida Fatemi. I was an academic hospitalist at University of New Mexico for a decade and had a leadership position there too. And it's just so exciting that we are moving forward with psilocybin for end of life. I'm now a founder of a hospice in town, ABQ Hospice, and I'm very excited to be able to offer this medicine for not only our patients who suffer at the end of life, but also their families. We also founded the Conscious Position Psychedelics Academy, which is a local academy, and we have CMEs providing through UNM School of Medicine, which is, I believe, one of a kind, being able to offer this. And nationally, there's 3 organizations that offer CME. So we really take pride in that, and our class just started. And I just want to let you all know that we are also holding ourselves to the highest degree of standard, following your lead of safety, consent, of ethics, of integrity, and making sure that we're teaching that to hospice providers in New Mexico. So yeah, thank you so much for leading this, Larry, and Dominic, and everybody else who's here. We are really leading the nation in this work, and your work is so important, and you're very much supported. Thank you so much.
Thank you, Dr. Lida. Next up to speak, again, apologies in advance if for any mispronunciation, James Hosobe. James, your microphone has been enabled. Will you please unmute yourself?
Yes, and perfect pronunciation, Hosobe. Thank you, Dr. Leeman, for hosting this meeting. Good morning, good afternoon, everybody, wherever you're at. My name is James Hosobe, and I'm a pharmaceutical scientist based out of Arizona. And I'm currently collaborating with the Arizona Department of Health involved in psychoactive psychedelic research. I'm deeply interested in this committee, particularly because it's a very unique realm of end-of-life care. And I think that we need to prioritize safety and be centered around patient dignity in their time of need. And I'm really excited to learn from everybody here today. Thank you.
Thank you very much, James. Next up in line to speak, Dr. Rosin. Dr. Rosin, your microphone has still been enabled this whole time. Will you please try to unmute yourself? Dr. Rosin, if you're there, we cannot hear you, unfortunately. If we're having some sort of connectivity issue, we've noticed if people simply log out and close the whole browser and Teams and log back in, they'd be more successful. As of this time, Dr. Leeman and Dominic, I have no one with their hand raised to speak, and there's nothing in the chat as of this moment. I stand corrected. Next up to speak is Van Warren. Van, your microphone has been enabled. Will you please unmute yourself? Van, if you're speaking right now, unfortunately, we cannot hear you. Your microphone is enabled. Will you please unmute yourself? In the chat, Van said he can't, and Joanna put, I'm sorry to be late, but I was unable to join from my phone, and I finally arrived home. So glad to be here. Thank you. Thank you for joining us, Joanna. So at this point, Van, you can put your correspondence, if you wish, in the chat. If you're not comfortable with that for whatever reason, then you may email us. Next, I'm going to go ahead and proceed to Barrick Wolf. Barrick, your microphone has been enabled. Will you please unmute yourself? Barrick, if you're speaking, unfortunately, we cannot hear you. Can you please make sure that your microphone is unmuted? Unfortunately, Barrick, we cannot hear you. If, like I mentioned earlier, usually if there's any type of technical issue, you may need to log out and log back in. In the chat, Dr. Rosin has said, I'm not sure why this isn't working. I am a family physician in Santa Fe, New Mexico. I'm an end-of-life provider who offers medical aid and dying as well as ketamine-assisted therapy at the end of life, specifically for end-of-life anxiety. Very excited to be here and very excited about the prospect of adding psilocybin to our menu of options for our patients in the time of their need. And Lorian stated, maybe remind people where the microphone icon is. Thank you, Lorian. We do have a PowerPoint slide that's usually up there.
And that slide is should be visible at this time for individuals who are on the computer. But just in case people aren't able to see it for any reason, the microphone icon is right next to the camera icon in the upper right of the screen in the menu bar. If you are on telephone, you just need to press *6 to unmute or mute.
Thank you, Dominic. Just for clarification too, I'm not seeing anything on mine except you and Lawrence and whoever's sharing their camera. Van,
thank you. I will try to.
I don't know if that's working now.
There you are. Thank you, sir.
Okay, good. My name is Van Warren. I'm a doctor of Oriental medicine. I live in the Albuquerque area. I am a death doula, end-of-life care specialist. I've worked as a chaplain and other things in the realm of the spiritual aspect of living and dying. And I want to thank you for allowing me to be here today and participate. My main concern and what I would like to bring to this is a discussion about accessibility. Who gets to use these this medicine for purposes of end of life? And I'm sure that's what we're going to be talking about a lot. But that's one of my big concerns right now. And thank you. I'm glad I found the microphone icon.
Thank you for that, Ben. All right, next up to speak is Barrick Wolf. Barrick, your microphone credentials have still been enabled from last time. Will you go ahead and please try to unmute by clicking on the microphone and you may speak.
I think this is working now. Is that right?
Yes, sir.
Okay, very good. Again, Barrick Wolf with End of Life Options New Mexico. And we work on the sort of front end of advanced care planning using volunteers across the state who are expert around those kinds of issues and end of life options. And we also work with the Medical Aid and Dying program, both in information, working with clinicians and hospices, and also working with individual clients who express interest in medical aid and dying. I love all the diversity of the folks on the Zoom today, or it's not a Zoom, it's a, I wish it were a Zoom. This has been hard to get used to, this platform, and it's quirky, but we'll figure it out. Larry Leeman, thank you so much, and I look forward to learning a lot. Thank you.
Thank you, Barrick. Lorian offered feedback in the chat for the PowerPoint slide to maybe it may be helpful if stated if in the upper right hand in the menu bar. Thank you, Lorian. And again, if anyone would wish to speak, go ahead and please click on the raise icon with the hand up, and we will call on you accordingly. All right, next up to speak is Trina Zaller. Trina, your microphone credentials have been enabled. Will you please unmute yourself?
Hi, everyone. My name is Trina Zahler. I'm a licensed clinical social worker here in Albuquerque. I have spent the majority of the past 12 years doing particularly hospice and palliative care at UNM and the VA, but I'm here just representing myself, joining these things entirely on my own time. I'm currently enrolled in the Integrative Psychiatry Institute's psychedelic therapy training program. They're through Boulder. That program goes through the end of February. I'm very excited after being a follower of the work that MAPS has been doing since 2004, working on drug policy at that time. Really excited to see these two interests of mine converge here in New Mexico and to get a chance to contribute to it and to help shape the conversation that we have about using this for, what I work with every day, life anxiety and all that anticipatory grief. Everyone.
Thank you, Trina. Next up to speak is Jennifer Johnson. Jennifer, your microphone credentials have been enabled. Will you please unmute yourself?
Hello, and thank you. I'm Jennifer Johnson. I am an RN, and I'm the clinical director at Red Willow Hospice in Taos, New Mexico. We have 3 locations in Albuquerque and Santa Fe as well. And we are in process of developing an end-of-life psychedelics program. We received a grant from Changing Minds, Healing Hearts Foundation to develop this program. So I'm really excited to be living in New Mexico right now. I personally went through the Naropa Psychedelics Facilitation Certificate Program in 2024, and now I'm getting to go through Dr. Lita's program, the Conscious Physicians Program. So I love getting to hear all of your voices and this building of community, and I cannot wait to utilize these medicines in the end of life. I think it's going to be really pivotal, as it has been for my own personal healing. So thank you.
Thank you, Jennifer. And again, as a friendly reminder, if you wish to speak, please raise your hand by hitting the raise hand icon. If you're on a computer, it's the hand icon at the top of the Teams window. If you're on the actual app on your phone, then you'll have to hit the 3 dots for the menu, and then the hand icon will appear. Once we call on your name, we'll enable your microphone, so that way you're able to unmute yourself and speak. If you're joining us through a telephone today, it's *5 to raise or lower your hand. Lawrence, are you able to hear me okay?
I am. I had to log in and out again. I was also afflicted with the Teams virus, apparently, but I'm back.
Perfect. Thank you for confirming.
Well, and it is great timing, Larry. It seems as though there are no other individuals to introduce themselves at this time. So if you'd like, we can move to the next item.
Yeah, before I just want to shout out to all of you. This is an amazing group we have in the state here. We have, several hospice docs interested, social workers, death doulas, advocates. Just an amazing group to be here. So I just want to share my excitement. We're going to go into a little bit of housekeeping here. We're gonna have some bylaws and just deal with a couple of little logistical issues that have come up, and then hopefully we'll descend into the interesting part here. So some bylaws that are really pretty short here, and sort of taken off of some other ones here. I just want to have people look at this with the hope that we can approve these today. We're known
Larry,
as a committee. Yes.
Before we go, I just want to make sure people can see the document. If I can get a few people to just do a thumbs up or just say in the chat yes, just want to make sure that people can see it. Okay, I'm seeing quite a few thumbs up, and thank you, everybody. I appreciate it. All right, sorry, Larry, go on ahead.
No, that's great. So yeah, a lot of this is a sort of basic boilerplate sort of thing. The committee is the committee, the board is the board. Our focus is going to be on safe patient safety, therapeutic effectiveness, consistency, and then there's a list of actual scope and responsibility. I'm going to cover that in a PowerPoint after that, but I want to just go through the rest of the bylaws before we do that. So I'll cover those. So we can scroll there. Wanted to mention a couple little housekeeping on committee membership. Committee members are basically those who attend and participate in the meeting. This is an inclusive group. It's not an exclusive group. Members include individuals with expertise in these areas. Public members strongly encouraged, especially like to people with chronic illness, cancer survivors, those with lived experience. One question's come up about out-of-state, participants, and here's an idea I'm proposing. That out-of-state participants definitely can attend and definitely speak at meetings, but they would not have people count for the quorum or have voting rights. With the idea that this is a New Mexico program for New Mexicans, I want to see if people have other feelings on that, but we definitely want to be inclusive. But I think it would be an odd to have sort of a vote where we had 10 people from out of the state out voting. So that's my proposal. My responsibilities are basically to convene the meetings and talk about how often we have those and be a liaison between the committee and the board. We'll talk afterwards about how often to meet, but I've had suggestions of every 2 weeks or once a month. And Kate has made a clarification about how the word care is there. Thank you, Kate. I appreciate that. I think that's an important thing. Of the 4 indications that are in the bill, I think it's important to remember that this is not a disease. End of life is a part of the life process and a condition, and it's care. So that makes us really different from the other indications. Voting and recommendations, a quorum, we're going to say that we need to have at least 6 members, and either the chair or a representative. Again, the out-of-state participants may attend. There's conflicts of interest. It's important that people disclose any actual or potential conflicts of interest. And if it's something that actually is particular to your interest, you may need to recuse yourself from voting. So that's the bylaws. Before we actually move to approve them, I'm actually going to go back to that kind of stuff in the middle here, where we're talking about the core areas here that are our scope of practice. I think for ease of this, I'm going to try something which I've never been successful in doing, which is sharing a PowerPoint on Teams. So wish me luck, and I'm going to see if I can do this. Is that working?
Yes, we can see it, Larry.
Yep. Yes. Great, thank you. Thanks for your patience. I'm fairly new to Teams myself. So, as far as like the core of what we're doing, this is, I developed, this, but with input from other people in the community, and it definitely, we'd love to have thoughts of other things that are important to be in our core role. But the 6 that are written here is, that we to define and discuss the scope for end of life criteria, therapeutic team development, inclusion of family and caregivers, sites for end-of-life care and education and workforce development, and finally an ongoing review and updates. So I'm going to go talk a little bit about these 6, and then we'll open up to a discussion about those topics and if there's other things that we should be viewing as part of our charter. So, the definition scope for end of life care, again, the other indications are fairly well defined: depression, substance use. Here, end of life, has more variation. I see it as part of our committee to be able to look at, what is meant by end of life care and consider that there could be palliative care, hospice care, and cultural perspectives. Proposal that we have an expansive time frames, including from the time of diagnosis of serious terminal or life-limiting medical conditions, or from the time of recognition that end of life is approaching due to the natural aging process. Part of that is the whole idea that the idea of the psychedelic assisted therapy is to help people live their life. It's not, focused just on helping people with the actual end of life. Therapeutic team development has come up from a couple people already, and this is the idea of developing therapeutic care team models that extend beyond a medical provider and licensed therapist, include, palliative and hospital-based nurses, social workers, and related professionals, but also look at emerging roles, psychedelic end-of-life doulas, and I think we have a couple of psychedelic chaplains on the call. And then one area to consider as we talk about access and equity, it's come up in discussion that the need for an entry-level facilitator role with appropriate state licensure support for inclusion in the program as part of the care team. Working with medical providers and licensed therapists. This comes from the idea that unless we have somebody that's at that entry level role, it's going to be hard to run things economically and promote access. Inclusion of family and caregivers. This I think is novel, likely to the end of life indication, but look at circumstances under which life partners, family members, or caregivers may participate in psilocybin assisted therapy as part of end of life care. And that may seem like a novel idea, but the way I would view that is this is about end of life care, and it doesn't mean that the only person who's having end of life can participate. This may be very helpful for the partners and caregivers to be able to have the opportunity to participate. Where should end-of-life care happen? I think that's an important area for us to discuss. We've heard several people here mention home. I know as the bill that developed, you would always mention that end-of-life care in particular may be important to support home-based care, and coordinating with hospices, home healthcare agencies, and healthcare and therapy facilities. Education and workforce development. I was happy to hear several people brought that up already. Supporting education and workforce development related to psilocybin assisted therapy. And I think this will be important to be interfacing with the committees that are working on the areas of education, working on workforce development. I think that the idea that everyone who's trained for using psilocybin assisted therapy has some exposure to end of life care, but also make sure that we have the availability of trainings that are going on nationally for people that are interested in having a more in-depth role of end of life psychedelic care. And then ongoing review and development, maintain a process for periodic review of emerging scientific literature, clinical guidance, and program data. There's besides the other state programs here, there's people up in Canada that are using psilocybin for end of life care. There's Arizona, there's a real interest in the ability to use psilocybin under the right to try legislation. So I think it'll be important for us to stay up on all of those. So anyway, that's just an overview of 6 areas, but I'd like to throw open to discussion here about, both what do people think about, these 6 areas as being important? Are there major other things that we're missing? And certainly this is an ongoing process, and we can be revising things, but just at the beginning to open up that discussion.
Dr. Lida is first. Dr. Lida, your microphone credentials have been enabled. Go ahead and unmute yourself.
Thank you so much, and thank you for the list of things, Larry. I think one of the questions that I have as a hospice physician is the criteria that determine an individual has the end of life diagnosis. Is it something that the diagnosis is by CMS criteria? Because that's what we use currently in the hospice world, is eligibility of hospice criteria that is set forth by CMS guidelines, which tend to be robust, but at the same time, for example, in a patient who's been given the diagnosis of dementia, if they're hospice appropriate, they are no longer able to, their FAST score is 7D, which, as physicians, we know that's, they're pretty much nonverbal. They can't consent. They can't, do any of that, which doesn't deem them appropriate for psilocybin therapy. And so my question would be, is our definition would be, are we catching these patients at the beginning of the diagnosis where they've been just diagnosed with mild dementia, for example? I think those types of things we need to be aware of, because the CMS policies and eligibility criteria is pretty advanced disease. Just a thought.
Thank you. Next up to speak is Trina. Trina, your microphone credentials have been enabled. Will you please unmute yourself?
I have two comments. One, to piggyback on what Dr. Fatemi was just stating. My hope is that we'll be able to offer this program for people who perhaps do have a diagnosis but are far before reaching a hospice qualification. And just having the bulk of my experience prior to about 2 years ago being predominantly in palliative care and seeing this really potent window for helping people to wrestle with their existential distress and to heal relationships with themselves and with family, while they still have the health and well-being to be able to do it. I think that would be a really important program that we could offer. And then secondly, forgive me if this was in the slides, but I wonder if we also want to add in your discussion about the role of integration. And mostly it comes up for me in thinking about the equity fund, and for people accessing this therapy, if we have also some type of parameters that we discuss about having that integration support following the medicine, maybe that will also open up funding sources for people who, perhaps have Medicare plans that are really restrictive on, providing behavioral health support or other limitations.
Thank you. Next up is Denali Wilson. Denali, your microphone credentials have been enabled. Will you please unmute yourself?
Hey, hi everybody. Thank you. I'm grateful to be here. I'm really excited about a number of things that you've laid out here, Dr. Leeman. I want to especially express gratitude and excitement for the early recognition that there needs to be an entry-level facilitator role that is permitted and authorized within the program. I'm really curious because I think we have to work within the language of SB 219, which I don't think precludes that, but does require some thoughtful thinking about whether, the department itself can create its own certification program, as has been done in other spaces. But it may be helpful to have an early conversation with this committee, and others, potentially the legal department at the Department of Health, about what would be needed to make that viable. I think it's not only really important for affordability and accessibility in this care protocol around end of life, but for all of the different indications, it's going to be really important that we find a way to make that happen.
Thank you. Okay, then, your microphone credentials have been enabled. Will you go ahead and please unmute yourself?
Yes, thank you. It struck me as wonderful when I read what you put up there about family members, because as anyone who's been around someone dying, yes, it's happening to that person, but the whole family is involved if the family is involved. Which sometimes is not the case. But, and of course, that brings up the question of if we involve family members in the actual use of the psilocybin, they do not have a diagnosis of imminent death, although, as we all know, we're all going to die. So we do all have that diagnosis. It's just not necessarily seen as imminent. So how that gets worked around in the law to have availability for family members and others who are in on this dying process is extremely important. And I thank you for including that. And somehow, hopefully, it'll get all worked out.
Thank you. All right, next up is Danielle. Danielle, your microphone credentials have been enabled. Will you please unmute yourself?
My mic is working now. Fantastic. Yeah, along with Van's comment, I'm curious about how we can make it work, but also the idea of extending the timeline for which family members have access, meaning for after the death has occurred, for bereavement and grief support. At the way codes work and diagnoses and everything, can we do that without it being complicated grief, just for everyday run-of-the-mill grief, if you will? So yeah, I think that's something that I'm really curious about, the family support.
Thank you. Again, as a friendly reminder, if anyone wishes to speak, if you're on a computer, please click on the hand icon near the top of the Teams window. It says raise under the icon. If you're on the actual Microsoft Teams app on your phone, you'll need to press the 3 dots, which will give you access to the menu for the hand icon to appear and select it. And if you're joining us through a phone, it's *5 to raise or lower your hand.
Okay, Larry, we're not seeing anyone else with raising their hand. So, except for you. So it's back to you, Larry.
Thanks, Tom. Appreciate that. This is good. I mean, it sounds like we have a lot of support and consensus around a lot of the issues that we want to talk here. I picked up one issue that does seem to be worth adding to the six on there, which is basically what is the therapeutic care plan for end of life regarding integration, number of sessions. And so if people are in agreement, I can add that as a seventh item to the to the scope of responsibilities. And we'll we'll come up with a good name for it. But basically, for a placeholder can be development of optimal therapeutic plans of care for end of life.
And looks like, I'm sorry, Catherine, your microphone has been enabled. If you wish to say something, please unmute yourself.
Yeah, I just wanted to say, but I think Larry, you did cover it, that I wanted to make sure that prep was also included, not just integration. And I think your new wording included that. So thank you.
Thanks, Catherine.
Next up is Dan. I apologize in advance if I mispronounce your last name. Dan Hussein. Dan, your microphone credentials have been enabled. Will you please unmute yourself?
Hi, sorry I'm a little bit late to this meeting. I just wanted to try to be a part of every one of them and let you guys all know that I can be a resource. My name is Dan. I'm with Rose City Laboratories in Portland, Oregon. We do the licensed psilocybin testing. We have been for the last 3 years since the program has been in operations. I've seen a lot of fluxes and changes in the industry and the way things are going. So unfortunately, I missed a lot of this conversation with you guys, but I am a resource. We've done a lot of studies when it comes to psilocybin, mushrooms, and different effects when it's mixed with different things and versus boiling versus non-boiling, and different studies on psilocybin that could be beneficial and helpful. We found that if you don't boil when you make tea, that things degrade really rapidly and are not locked in versus boiling. So if it's okay with you guys, I can drop that in the chat. I just really encourage meet the people where they're at, and try to not have to make them go somewhere to do something. The end of life people. I can understand for sport people and everybody else, but end of life people, try to meet them where they're at. Thank you.
Thank you.
Larry, there's no one else with their hands up at this time, so back to you.
Great. I think there's a theme in a couple of different issues. I want to share my thoughts on this, which is, well, what can we do? I mean, what is the law? What can we do? And I would encourage us as a committee to start out thinking what we think is the best thing. What is the best thing for New Mexico and the state? And then, yes, we'll have to get some, legal opinions on different things. My own opinion from reading the bill is that it doesn't specify an indication of, let's say, anxiety or depression associated with end of life. It's end of life care. And so end of life care would be covered by, for a partner or caregiver. But again, I'm the physician, not the lawyer, but that would be my interpretation of that. I think similarly, as far as the role of the developing facilitator, different things, I would encourage us to take our best shot at what's the vision of ideal care, and then sort through how does that work out as far as the needing to create another position. I really appreciate Denali bringing up the that question, because I have heard that there may need to be another bill or such to add a facilitator position. I've also heard other people saying perhaps not, but perhaps the DOH can create that. But I think our goal early on could be to develop the best program that we can envision. Anyone want to move to approve the minutes of the bylaws? Or maybe more importantly, anyone opposed to approving the bylaws?
And I was just going to say, Larry, since this is a more of a working group, all you really need is sort of a consensus with regard to that. And so I would recommend, just if anybody has an objection to the bylaws, with the portion of Dr. Leeman adding in that last section regarding the development of optimal care plans, that go ahead and raise your hand at this time. And otherwise we'll move forward with them as adopted, if that's okay with you, Larry.
Sounds good to me.
I'm not seeing anybody raise their hand. We'll give it just a few moments more. All right, Larry, you have bylaws for your committee. So.
Excellent, thank you. I guess the next topic to me is how do we move forward? Like what's our best way to move forward? One of those would be the question of how often should this group meet? You know, just speaking to people, I've heard people suggest every once a month, every 2 weeks. I'm going to just propose myself that we start out with every 2 weeks and see where that goes. We may decide that that's too often, but hopefully it'll get us off to a quick start. So I wanted to see what people think about that. Thumbs up, thumbs down. Yeah, how do you want to be? There's nothing preventing us from meeting more often, but I think getting more than every 2 weeks tends to be hard for most people's schedules. I want to call, I mentioned this, Senator Jeff has, as a bill sponsor, shares the opinion as far as the wide view about rules. So we thank you very much, Dr. Steinberg.
Gentlemen, we have Dr. Roxroy Reed raising their hand to speak. Dr. Roxroy, your microphone credentials have been enabled. Will you please unmute yourself? Dr. Reed, if you're speaking, unfortunately, we cannot hear you. As a friendly reminder, please make sure you tap on the microphone icon if you're on Teams on the computer or on the app. If you are on a phone, I believe it is *6 to unmute. Dr. Reed, unfortunately, again, we cannot hear you. So if you don't mind sharing your correspondence in the chat, we will also provide the email to you if you wish to do that.
Okay. And Larry, we do have several people who have commented in the chat that 2 weeks is good. So I would say, similar to the bylaws, if there's no objections, we just move forward with 2 weeks. That would put the next meeting at Thursday, January 22nd at 3 p.m. Sounds good. Okay, not seeing anybody with objecting on that, and Larry giving us a thumbs up. We'll go ahead and the department will get that scheduled. Just as a logistical note for individuals, one of the things that we are doing is as we get those meetings scheduled, we are sending out a weekly or almost weekly, because we're waiting for these first several meetings of the different committees to conclude so that we can actually then post in one email and send it out through the Constant Contact, which is our email list, and send it out with a list of all of the links and the different committee meetings and times. So we should have that. We do have a couple of more meetings over the next couple of business days. And then about the middle of next week, we should be sending out that notification with all the new meeting updates and links. So just to let everybody know from a logistics standpoint. So just bear with us for a couple more business days until the last of the initial meetings have passed, and we'll get them all out again in one email. And if you have not signed up for the Constant Contact, the way to do that is actually go to the New Mexico Department of Health website, www.nmhealth.org. And in the upper right-hand side, there's a little link saying sign up for e-news. And once you click on that link, it'll take you to an information sign-up page. You just sign up, include your information, email, and then click on the Medical Psilocybin program box. You can also, by the way, if you have interest in some of the other topics, click on those boxes as well. You can click multiple boxes at the same time, and then just click sign up. You may then need to confirm that, as usual, you are not a robot. And then once you do that, you'll be added to our Constant Contact email list and be able to receive updates and notifications about the program. And we are sending out all of the meeting links as we do have the next meeting set up. We're sending them through there, so you can be assured that you won't miss them. The one thing, of course, is as with any email list, please always check your junk mail folder. Sometimes email list items do go to junk mail. So we just want to make sure that people who would like to get information are able to do so. And then again, just as a reminder, when the meeting is over, if you were not able to speak for any reason, or you think of something that you would like to include in as part of public comment and did not do so during the meeting, if you send it to our email at medical.psilocybin@doh.nm.gov, which is also in the chat, we will include it in the meeting record. For it to be included for this meeting, please send it by the end of day tomorrow, January 9th at 5 p.m. And now I'm going to go back to you, Larry. I think I've gone through enough of the logistics at the moment.
Thanks as always, Dom. I wanted to just propose a structure, at least for the first few meetings. We have really sort of a relatively distinct field here at End of Life Psilocybin Care, and we have a lot of resources both here and out of state. I'm going to propose that we include maybe a 15 to 20 minute educational presentation by people in different areas at each of the meetings. For instance, we might have a end of life chaplain, so we can learn about that. We might have people who've had experience offering end of life care in different ways, and as a way of sort of doing self-education that may eventually include like clarifications on some legal issues or other issues, but just as a way of doing self-education. And the other part of that would be we now have like 7 areas so that people could start. We'll have to figure out how to coordinate that at the meetings, but think a little bit about which of those areas are of particular interest. Like maybe, you're really interested in the therapeutic care plan. So, this is a subcommittee, but we could have a smaller group in that meets and talks like outside of these meetings and then presents it to us. So I'd like to encourage people that, the goal of this to be kind of an interactive co-creating. So think going towards the next meeting, are there areas that you're particularly interested in? And I dropped my email there. That's my work email. It's I'm happy to get emails if people have thoughts about who might be good to come speak with us, or conversely, just like I want to learn about this, and then make it my job to find somebody. But either way, and we'll try to get that, keep it interesting and educate each other. But these are just my ideas of doing this. I also want to see if people have other thoughts. I'm proposing right now we have a Q2 week meeting proposing having some education, groups coming together. Any other thoughts on the way to move forward as a committee? If you have other thoughts, raise your hand, put it in the chat, or if you just like what I'm saying, thumbs up, or
Thank you, Lawrence. Next up, first requesting to speak is James Wasabi. James, your microphone credentials have been enabled. Will you please unmute yourself?
Yes, thank you. Dr. Leeman, I absolutely love the fact that you want to bring on individuals to shed light on their expertise. Just yesterday, we had a Senate meeting of the right to try here in Arizona and really pushed that through Dr. Sue Sisley. So I think it's an excellent route to explore, and I'd love to maybe make that warm introduction to get people on from Arizona to help with New Mexico. Thank you.
Thank you. I'm just going to share something. Sue's actually has some connection to New Mexico. At UNM, we're going to be doing psilocybin research in alignment with the state program. Sue is the only FDA-approved grower of psilocybin mushrooms, and her psilocybin-infused chocolates will be used in our research from Scottsdale, Arizona.
Thank you for clarifying, Dr. Leeman. Next up, requesting to speak is James Brown. James, your microphone credentials have been enabled. Will you please unmute yourself?
Hey, Larry, I was hoping to also we'd kind of focus on, because of this elderly population, typically that we're looking at, their pharmacokinetics and dynamics is very, very unique. And psilocybin, works in those people population differently than typically that we'll see in these other groups that'll be, potentially using this medicine. And I just want to make sure that the group focuses on that, as well as besides the age and everything from weight to their renal function, their liver functions, because of the P450 enzymes. Medications is a big thing with the elderly. They're on a lot of polypharmacy, and then this might interact with some of those polypharmacy things. And so I like to see the group kind of focus on some type of, screening or some type of tools necessary that we can use for practitioners so they feel comfortable and educated.
Thank you, James. Next up, requesting to speak is Dr. Reed. Dr. Reed, your microphone credentials have still been enabled from your last request. Will you please attempt to unmute yourself? Dr. Reed, unfortunately, if you're speaking, we cannot hear you. As a friendly reminder, if you are on the Microsoft Teams application on your computer, there will be a microphone icon, usually towards the top right, I believe. Otherwise, you can go to directly to the icon if you're in that Teams app. And if you're joining us by telephone, it's *6 to mute or unmute. I apologize, but again, Dr. Reed, we cannot hear you. If you wish to maybe possibly log out and log back in, or you can put your correspondence in the chat. And Dominic has made the email available if you would prefer that method as well.
Okay, and Larry, there's no one else in the chat as far as for speaking, so back to you.
Well, what I would say is if we don't have any more comments or suggestions, then we get to call it a little bit early, get a half hour of your life back, and we'll wind up here. I think what we'll do is continue to schedule the meetings at 2 hours, but personally, I think 2 hours is a long meeting, and I think if we winding up at an hour and a half or hour and 15 minutes, that's just great. But if we'll make it in a 2 hour slot, so we have the ability to be expansive. My email is there if there's thoughts of topic speakers. I appreciate we already got 4 or 5 good topics that we want to learn about here, so we'll move ahead on some of those, and I will present all of our good thoughts at the board meeting next week. So thanks everybody, and enjoy your week.
thank you, everybody, on behalf of the department, and thank you, Dr. Leeman, for hosting and chairing the meeting, and everybody for joining, and thank you to Senator Jess Steinborn for joining in and listening in. So thank you, everybody. Have a great rest of your day. And for those who are interested in being on any of the other meetings, you can find them on our website in the announcement sections. We do have them there with the links available. And tomorrow's meetings are the Research and Improvement Committee and the Propagation Committee. So thank you, everyone.